Hello, everyone, and welcome. I'm excited to kick off our session today. Our first slide introduces the topic, comprehensive overview of the human respiratory system. We'll be exploring its anatomy, physiology, clinical implications, and airway management. Over the next few slides, we'll delve into each of these areas to give you a thorough understanding. So let's get started. Now, let's take a closer look at the introduction to the airways. In this chapter, we'll explore both the structure and function of the airways within the lungs. The airways are absolutely vital because they serve as the main pathways that transport air in and out of the lungs. Without them, oxygen wouldn't reach the deeper parts of the lungs, and carbon dioxide wouldn't be expelled effectively. Moving on, a key point here is the role of the alveoli. These tiny sac-like structures are truly essential for respiration. They are the primary sites where gas exchange occurs. Oxygen from the air passes into the blood, and carbon dioxide is removed from the blood to be exhaled. Throughout this presentation, we'll see how the airways and alveoli work together seamlessly to ensure efficient breathing. Understanding this connection helps us appreciate the complexity and elegance of the respiratory system as a whole. Let's take a closer look at the ventilation mechanism, which is essentially how air moves into and out of our lungs. This process is crucial because it ensures that our lungs are constantly supplied with fresh air, allowing for effective gas exchange. Without proper ventilation, our body can't get the oxygen it needs or remove the carbon dioxide produced by our cells. Now, speaking of gas exchange, this is the core function happening within our lungs. The lungs bring atmospheric gases into contact with our blood, facilitating the exchange of oxygen and carbon dioxide. Oxygen from the air we breathe in diffuses into our blood, while carbon dioxide, a waste product, moves from the blood into the lungs to be exhaled. This process occurs at the level of the capillaries and tissues, making sure every part of our body gets the oxygen it needs and that waste gases are efficiently removed. Moving on to the function of the lungs, they must operate with both efficiency and reserve capacity. This means they should work smoothly and with minimal effort during normal breathing, but also have the ability to handle increased demands, such as during exercise or stress. Maintaining this balance is vital for overall respiratory health and performance, ensuring that our body can adapt to different activity levels without compromising oxygen supply. So, in the context of the overall presentation, understanding these mechanisms highlights how our respiratory system is finely tuned to support our body's needs, not just at rest, but also during higher levels of activity. Now, let's focus on the primary function of the conducting airways. Their main role is quite simple, but absolutely vital. They serve as a pathway for air movement. This means that their job is to make sure the air we breathe in reaches the gas exchange areas in our lungs efficiently and without any hassle. To clarify, conducting airways are essentially the air tubes that connect the outside environment, where we breathe in from, to the gas exchange membranes deep inside the lungs. It's important to remember that these airways do not participate in the actual process of gas exchange. Instead, they act as a highway, guiding the air to where it needs to go. In terms of their role within the respiratory system, conducting airways are fundamental for maintaining a smooth airflow. They act as a conduit, a passageway that ensures air gets to the lungs without directly engaging in the exchange of oxygen and carbon dioxide. This separation helps optimize the entire breathing process, making sure oxygen reaches our blood efficiently and carbon dioxide is expelled effectively. Let's take a closer look at the components of the upper airways. These include the nose, the oral cavity, the pharynx, and the larynx. These structures are really important because they handle the initial stages of air conduction, meaning they prepare the air before it reaches the lungs. Now, focusing on the oral cavity, it's not just for eating or speaking, but also serves as an alternative pathway for air intake. This becomes especially important during activities like talking loudly or when we're breathing heavily, where the nose alone might not be enough. Moving on to the upper airways as a whole, the pharynx and larynx are vital. They help direct air smoothly into the lungs, but they also have other roles. For example, They are involved in producing our voice and protecting the airway during swallowing, preventing food or liquids from going down the wrong way. And of course, the nose is the primary entry point for air. It does a lot more than just look good. It's responsible for filtering out dust and other particles, warming the air to body temperature, and humidifying it so that the delicate tissues in our lungs aren't irritated. Understanding these components helps us see how interconnected and efficient our respiratory system truly is, especially in how it prepares and protects the air before it reaches our lungs. Let's take a closer look at airflow resistance and filtration. The nasal structures are specially designed to increase airflow resistance, and this might sound counterintuitive at first, but it's actually crucial for effective air conditioning and filtration. By creating some resistance, the nose helps regulate the flow of air, allowing it to be warmed, humidified, and cleaned more efficiently before reaching the lungs. The nose essentially acts as a natural air conditioning and filtering device. When we breathe through our nose, it warms the inspired air, making it less shocking to our delicate lung tissues. It also humidifies the air to prevent dryness, which is especially important in dry environments. And of course, it filters out dust, pathogens, and other particles, ensuring that cleaner air enters our respiratory system. This filtration and conditioning process is why, at rest, the nose is the preferred route for breathing. It plays a vital role in maintaining respiratory health by preparing the air for the lower respiratory tract. So, in essence, the nasal structures are not just passive pathways. They are active participants in ensuring that the air we breathe is as clean and comfortable as possible. This function highlights how intricately our respiratory system is designed to protect and optimize our breathing. Let's take a closer look at the nares, which are actually the smallest diameter part of the upper airway. Despite their size, they play a very important role in regulating airflow as it enters the nasal cavity. Essentially, they act as the gateway, controlling how much air moves in and out. Moving on to the conchae, also known as turbinates. These are the superior, middle, and inferior structures that create three irregular passages within the nasal cavity. What's fascinating about them is that they greatly increase the surface area inside the nose, which is essential for warming, humidifying, and filtering the air we breathe. Now, focusing on nose anatomy, one key component is the respiratory mucosa. This is a mucus-secreting epithelium located in the posterior third of the nose. It's supported by an extensive network of capillaries, which can change the thickness of the mucosa. This flexibility helps in regulating temperature and humidity of the inhaled air, adapting to different environmental conditions. Finally, let's talk about the nasal septum. This is the structure that divides the nasal cavity into two separate channels called nasal fossae. Its proper organization is crucial for ensuring that airflow is evenly distributed and that each side functions effectively. Overall, these structures work together to optimize our breathing process, which is fundamental to our overall respiratory health. When we consider intubating a patient with an endotracheal tube, or ETT, it's important to understand which anatomical structures we are bypassing. Essentially, by inserting the tube through the mouth or nose and into the trachea, we are skipping over the upper airway. This includes structures like the nose, the oral cavity, the pharynx, and the larynx. Now, these structures do more than just conduct air. They play crucial roles in conditioning the air we breathe. They warm, humidify, and filter the air to protect the lower respiratory tract. They also serve as protective reflex centers, helping us cough or clear the airway if something irritates it. When we bypass these natural defenses, we have to be aware of the implications. For example, without the air conditioning functions, the lower airways might be exposed to colder, drier air, which can cause damage or inflammation. And missing out on protective reflexes means there's a higher risk of aspiration or respiratory complications if foreign material enters the lower airways. So, understanding which parts we bypass helps us anticipate potential complications and manage them effectively, especially in critical care settings. This ties back to the overall theme of maintaining airway patency and ensuring safe, effective ventilation. Now, let's take a closer look at the oropharynx. This part of the respiratory system is located right behind the oral cavity, so it plays a crucial role in both breathing and swallowing. It extends from the soft palate at the top down to the base of the tongue. This positioning makes it a key passageway connecting the mouth and the lower parts of the throat. Moving on to the nasopharynx, which is situated right behind the nasal cavity. Think of it as the uppermost part of the pharynx, extending downward to meet the soft palate. Its location is vital because it helps facilitate airflow from the nose to the rest of the respiratory system. Now, the pharynx itself is divided into different regions, and understanding these divisions helps us see how the system functions efficiently. The laryngopharynx, for example, is positioned below the base of the tongue and just above the larynx. It acts as a pathway that guides both air and food, depending on the situation, ensuring they go where they need to go without interference. By understanding these divisions, oropharynx, nasopharynx, and laryngopharynx, we get a clearer picture of how the respiratory and digestive pathways are organized and interconnected. This knowledge is fundamental as we explore how the respiratory system supports vital functions like respiration, speech, and protecting the airway. Let's take a closer look at the pharynx and its reflexes. The pharynx plays a crucial role in protecting our airway through reflex responses. These reflexes are initiated when sensory input is detected, primarily through the glossopharyngeal nerve, which is the ninth cranial nerve. This sensory pathway is essential because it helps us recognize potential threats, like food or irritants that could enter the airway. Once this sensory information is received, the next step involves motor control. The vagus nerve, or the 10th cranial nerve, takes charge here. It governs the motor responses necessary for actions like gagging and swallowing, which are vital for preventing choking and aspiration. Now, from a clinical perspective, it's important to note that in patients who are deeply unconscious, these pharyngeal reflexes are often diminished or lost altogether. This loss significantly increases the risk of respiratory aspiration, which can lead to serious complications like pneumonia. So, understanding these reflex mechanisms is key because they highlight how our body naturally protects the airway, and also why caution is needed in unconscious patients to prevent respiratory issues. Let's take a closer look at the anatomy of the pharynx and how it can contribute to upper airway obstruction. The pharynx plays a crucial role in our respiratory system, but its structure can sometimes pose challenges. When muscle tone decreases, such as during sleep or relaxation, the soft tissues within the pharynx tend to relax as well. This relaxation can lead to a narrowing of the airway, making it more difficult for air to flow freely. This is especially important because it highlights how changes in muscle tone and tissue relaxation can impact airflow. Essentially, the anatomy of the pharynx can either facilitate smooth breathing or contribute to obstructions that impair airflow. Understanding this helps us see why conditions like sleep apnea occur, where the airway repeatedly narrows or closes during sleep. So, in summary, the pharynx's structure and its muscle tone are key factors in airway patency. When muscles relax and tissues loosen, the risk of airway obstruction increases, which ties back to the overall theme of respiratory health and the importance of maintaining open airways for effective breathing. Obstructive sleep apnea, or OSA, is a condition that definitely requires clinical attention because it can have significant impacts on overall health. When managed effectively, we can see improvements in symptoms and also reduce the risks associated with the condition. One of the most common treatments for OSA is continuous positive airway pressure, or CPAP therapy. This involves wearing a mask during sleep that delivers air at a steady pressure, usually between 6 to 12 centimeters of water, to keep the airway open and prevent obstructions. We measure the severity of OSA using what's called the Apnea-Hypopnea Index, or AHI. This index tells us how often breathing is interrupted during sleep, whether through complete pauses or shallow breaths. It helps us understand how serious the condition is. Patients with OSA often experience symptoms like loud snoring, feeling very sleepy during the day, fatigue, and even headaches. These symptoms can really interfere with daily activities and overall quality of life, so recognizing and addressing them is crucial. Now, it's important to understand how sleep itself impacts the airway. During sleep, the muscles in the throat relax, which reduces pharyngeal muscle tone. This relaxation can cause the soft tissues in the throat to collapse and obstruct the airway. That's a key physiological factor in the development of OSA. So, in summary, recognizing how sleep influences airway patency helps us better understand why OSA occurs and how to target its treatment effectively. Addressing these factors can lead to better management and improved health outcomes for those affected. Now, let's take a closer look at how obstructive sleep apnea works. During sleep, our muscles relax and gravity pulls soft tissues like the tongue and surrounding areas toward the back of the throat. When this happens, these tissues can actually block the airway. This obstruction prevents air from flowing freely, which leads to apnea, or in some cases, hypopnea, which is a partial blockage. Essentially, the airway gets temporarily closed off, causing breathing to stop or become very shallow. This cycle of blockage and reopening is what characterizes obstructive sleep apnea. Understanding this mechanism helps us see why this condition can cause disrupted sleep and other health issues. It ties into the overall theme of respiratory health by highlighting how structural factors during sleep can significantly impact airflow and breathing quality. Now, let's talk about CPAP therapy, which stands for continuous positive airway pressure. This treatment is essential for maintaining an open airway during sleep. It works by delivering a steady stream of positive pressure through a mask, which helps keep the airway from collapsing. This is particularly important for those with sleep apnea, where airway blockage disrupts breathing. By preventing airway collapse, CPAP therapy significantly improves breathing quality during sleep. It's a crucial part of managing respiratory health and ensuring restful, uninterrupted sleep. Connecting this to our overall theme, it highlights how maintaining airway patency is fundamental to respiratory function and overall well-being. Now, let's take a closer look at the vocal cords and their vital role in our respiratory system. The larynx, or voice box, contains these vocal cords, which are essential for sound production. When we speak or sing, these cords vibrate as air passes through them, creating the sounds we recognize as voice. Moving on to the overview of the larynx itself, it's a cartilaginous, cylindrical structure situated at the top of the trachea. Think of it as a kind of valve that controls airflow and protects the airway during swallowing. When we examine the anatomy of the larynx, one of the most prominent parts is the thyroid cartilage, often called the Adam's apple. This cartilage is the main supporting structure of the larynx and is located roughly around the C4 to C6 vertebral levels in the neck. Understanding these structures helps us appreciate how complex and vital the larynx is, not only for voice production, but also for breathing and protecting our airway. It's a perfect example of how the respiratory and vocal systems are interconnected, playing a crucial role in our daily communication and survival. Let's take a closer look at the vallecula, which is a key landmark during intubation. The vallecula is the space between the epiglottis and the tongue. Recognizing this space is crucial because it helps guide the placement of the endotracheal tube accurately. During intubation, identifying the vallecula allows us to visualize the glottis more easily and ensures the tube is positioned correctly. Now, moving on to the epiglottis. The epiglottis is a thin, flat, leaf-shaped piece of cartilage located above the glottis. Its main role is to protect the airway during swallowing by covering the opening to the larynx. This prevents food or liquids from entering the lungs, which is vital for preventing aspiration. Finally, when we look at the larynx, we see these important structures, the vallecula and the epiglottis, that serve as landmarks. Their proper understanding and identification are essential not only for safe airway management, but also to connect the overall function of the respiratory system with clinical procedures like intubation. Recognizing these details helps us ensure patient safety and effective airway control during critical moments. Now, let's take a closer look at the epiglottis. The epiglottis functions as a protective flap that covers the glottis during swallowing. Its main role is to prevent food and liquids from entering the trachea, which is crucial for keeping our airways clear. When we swallow, the epiglottis flips down over the glottis, acting like a lid that seals off the windpipe. This simple yet vital action helps us avoid aspiration, which could lead to choking or respiratory infections. In the context of the overall respiratory system, the epiglottis plays a key protective role, ensuring that the airway remains open for breathing while safeguarding it during eating and drinking. In this clinical case, we see a young boy presenting with some classic signs of epiglottitis. His vital signs show an elevated temperature, a fast heart rate, and an increased respiratory rate, all of which suggest his body is fighting an infection and struggling with airway issues. His muffled voice is another important clue, indicating swelling around the epiglottis that affects his ability to speak clearly. Now, this particular patient is a 2-year-old boy who arrives at the emergency department around 2:00 a.m. Notice how he's sitting upright and leaning forward. These positions are typical as children try to open their airway to breathe more easily. He's drooling, which is a sign that swallowing is painful or difficult due to swelling, and he appears quite anxious, which makes sense given his distress. When we look at the diagnostic imaging, specifically the lateral X-ray, it reveals what's called the thumb sign. This is a classic radiographic feature of epiglottitis, where the swollen epiglottis looks like a rounded thumb. This finding is highly indicative of the diagnosis. Putting all of this together, the clinical presentation, vital signs, and imaging leads us to a strong suspicion of epiglottitis. Recognizing these signs quickly is crucial because it indicates potential airway obstruction, which can become life-threatening if not managed immediately. That's why prompt medical intervention is essential to secure the airway and treat the underlying infection. Let's talk about the critical management of epiglottitis. Recognizing the symptoms early is absolutely essential because prompt identification can make all the difference. When you see signs like sudden difficulty swallowing, drooling, or a muffled voice, think quickly and act fast. Effective airway management is the next vital step. Ensuring the airway remains open and secure can prevent serious complications, even respiratory failure. Now, understanding what epiglottitis actually is helps us respond appropriately. It's a potentially life-threatening inflammation of the epiglottis, the flap at the back of the throat that covers the windpipe during swallowing. If it swells, it can block the airway entirely, which makes this a true medical emergency. So, in summary, early recognition combined with swift, effective airway management is key. Keeping this in mind aligns perfectly with our overall goal, protecting the airway and saving lives when dealing with this serious condition. Let's take a closer look at the laryngeal reflex, starting with laryngospasm. This is a protective mechanism where the airway closes suddenly to prevent foreign substances from entering the lungs. It acts like a safeguard, helping keep our lower respiratory tract clean and safe. Moving on, when there's vocal cord edema, such as in conditions like croup, it can cause a high-pitched sound called stridor. Stridor indicates that there's some airway obstruction, and it's a sign that the airflow through the upper airway is compromised. Recognizing this is crucial for timely intervention. Now, let's consider artificial airways. While they are often necessary in certain clinical situations, they can reduce the effectiveness of coughing. Since coughing is a key way our body clears the lungs of irritants and secretions, any impairment here can compromise our lungs' natural defense mechanisms. Next, the vocal cords play an essential role in coughing. They open and close rapidly to generate the pressure needed for a strong cough. This process is vital because coughing is one of our primary defenses against inhaled pathogens and debris. Finally, understanding the structure of the glottis is important. The glottis is the triangular opening into the trachea, and it's actually the narrowest part of the adult upper airway. The vocal cords are situated here and work together with the glottis to control airflow, protect the airway, and facilitate functions like phonation and coughing. By understanding these key mechanisms, we can better appreciate how our respiratory system protects itself and what happens when these processes are disrupted. Now, let's take a closer look at the supporting structures of the human respiratory system, specifically the surrounding cartilages and muscles that play a vital role in voice production. These structures support the vocal cords and are essential for regulating their tension and the way they open and close during speech and breathing. By controlling these movements, they help us produce different sounds and phonations. Moving on to the true vocal folds, these are what we usually think of as the vocal cords. They're responsible for generating sound when air passes through them, causing vibrations. But their role goes beyond just voice. They are also crucial for protecting our airway. When swallowing, for example, they close tightly to prevent food or liquids from entering the trachea and lungs. In terms of anatomy, the vocal cords are composed of multiple layers, including muscle and tissue, that allow for fine-tuned control of pitch and volume. Understanding their structure and function is key to appreciating how our voice works and how we can care for it. So, in summary, the supporting cartilages and muscles maintain the position and tension of the vocal folds, enabling us to speak clearly and protect our respiratory pathway at the same time. These structures are integral to the overall function of the respiratory system, especially in voice production. Let's take a closer look at the tracheobronchial tree, which forms the lower airways of the respiratory system. The journey begins at the trachea, which acts as the main passageway for air to enter the lungs. This point is crucial because it marks the start of the complex branching system that ensures air reaches every part of the lungs efficiently. From the trachea, the airway divides into two smaller branches, a process known as dichotomous branching. Each of these branches then splits again, creating successive generations of smaller airways. This pattern of division is what allows the airway network to become highly intricate and efficient. This branching system isn't just about creating a network. It's designed to distribute air effectively throughout the entire lung tissue. As the airways branch and become smaller, they direct air toward the gas exchange regions, where oxygen and carbon dioxide are exchanged with the blood. So, in essence, this lower airway system is a finely tuned, branching architecture that plays a vital role in ensuring that oxygen reaches our bloodstream efficiently, supporting the overall function of our respiratory system. Now, let's take a closer look at the bifurcation of the trachea. At its lower end, the trachea splits into two main branches, the right and the left mainstem bronchi. This split is really important because it marks the beginning of the bronchial tree, which is responsible for directing air into each lung. Moving on to the structural support of the trachea, it's supported by a series of 8 to 20 C-shaped cartilages. These cartilages give the trachea its shape and keep it open, ensuring that air can flow freely. The trachea extends from the cervical vertebra C6 down to thoracic vertebra T5, which makes it about 11 centimeters long in adults. Finally, let's talk about the anatomical position of the trachea. As I mentioned, it runs from C6 to T5, and this positioning is really crucial for its role in respiration. It sits in the neck and upper chest, providing a clear airway from the larynx down into the lungs. Understanding its location helps us appreciate how it functions seamlessly within the respiratory system. Let's take a closer look at the right bronchus. It deviates about 20 to 30 degrees from the midline, meaning it angles more sharply compared to the left. It's also shorter and wider in diameter, which has important implications. These anatomical differences affect airflow dynamics and are especially relevant during clinical procedures like intubation, where understanding the bronchus orientation helps ensure proper placement. Now, turning to the left bronchus, it deviates more, about 45 to 55 degrees from the midline. It's smaller in diameter than the right bronchus and approximately twice as long. These features again influence airflow patterns and are crucial considerations during procedures involving the airway. Overall, these structural differences between the right and left bronchi are key to understanding how air travels into the lungs and how clinicians approach interventions safely and effectively. Let's now look at the risks of aspiration during airway management. When we talk about aspiration, we're referring to the inhalation of foreign material, like stomach contents, into the lungs. If this happens, it can lead to serious complications such as aspiration pneumonia, which can be quite severe. That's why airway protection is so critical. Preventing aspiration is essential to avoid these potentially life-threatening infections. Moving on to the consequences of endotracheal tube, or ETT, misplacement. Specifically, if the tube is inserted too far. When the ETT goes too deep, it might enter a mainstem bronchus, usually the right, causing only one lung to be ventilated. This not only compromises oxygenation, but can also cause lung injury or trauma. Precise tube placement is therefore vital to ensure both lungs are properly ventilated and to prevent injury. Now, let's consider some clinical questions related to intubation. These questions are designed to emphasize the importance of accurate airway procedures. Proper technique and correct tube placement are not just procedural steps, they are fundamental to patient safety. They help prevent complications like aspiration and lung injury, and ultimately ensure better outcomes for our patients. Throughout this presentation, we've seen that understanding these risks and the importance of precision in airway management is key. It ties into the bigger picture of providing safe, effective respiratory care. Let's take a closer look at this clinical case involving an intubation complication. During auscultation, we heard breath sounds on the right side, but notably absent on the left. This is a critical clue, suggesting that the endotracheal tube may have been inserted too far, possibly into the right mainstem bronchus, or there could be an obstruction on the left side of the airway. The patient in question was a 58-year-old male who was in full cardiac arrest and was being ventilated with a bag valve mask prior to intubation. During the process, there was difficulty inflating the lungs, and we observed uneven chest rise. These signs are very important because they alert us to the possibility that the tube is not properly positioned, which can compromise ventilation and oxygenation. This case really underscores the importance of careful tube placement during emergency airway management. Continuous monitoring, especially auscultation, is essential to confirm correct placement. If we don't pay close attention, we risk complications like hypoxia or further airway injury. Finally, the key takeaway here is that signs like uneven chest rise and difficulty with lung inflation are critical indicators that something might be off. Recognizing these signs immediately allows us to take swift action, reassess tube placement, and ensure proper ventilation, so we can provide the best care possible in emergency situations. Let's discuss the importance of the isothermic saturation boundary, or ISB. Maintaining the ISB is essential because it helps preserve the integrity of the mucosal lining in our respiratory system. This preservation is crucial for protecting our airways and ensuring they function properly. The ISB is strategically located just below the carina, where inspired air reaches full humidity and a temperature of about 37 degrees Celsius. At this point, the air is completely saturated with water vapor, which creates optimal conditions for gas exchange in the lungs. The role of the ISB is to ensure that the air we breathe in is fully humidified, which is vital for efficient oxygen and carbon dioxide exchange. By maintaining these ideal conditions, the ISB plays a key role in supporting overall respiratory health and function.